over. So first off, especially because we have a German Shepherd rescue here, is bloat. Has everyone heard of bloat before? Yes, no, yes, some people, okay. So bloat has two parts to it. Sometimes they go together, sometimes they're individual. But bloat, the scientific word for it is a GDV, or gastrodilatation and volvulus. Sometimes it's just the dilatation. I'm not going to make this super sciencey, but that dilatation is just that the stomach gets filled with gas or overfilled, but usually it's with gas or air. And the volvulus is when it actually spins on itself. So this is one of the most common emergencies when you're looking at most of your shepherds, most of your giant breeds, Great Danes, St. Bernards, things like that. It is an emergency. It used to have a much lower success rate when it came to treatment. Treatment of choice is surgery. As of right now, or as of yesterday, the success rate is 80%, which is great because about 3 years ago, the success rate with surgery was 25%. So what it does stink about GDV is there's not much that you can do for it at home once it's happened, but there are a few things that you can do to prevent it. So once it's happened, I'm going to tell you guys what to look for that, but you want to rush to an ER or a vet to prevent it. Biggest things are small kibble. So you got to be a little careful because they are now selling larger kibble for dental health. So a lot of your dental diets have bigger kibble to cause or to get them to chew because they can swallow that quicker. When it hits the GI acids, they'll actually inflame, get much bigger, and then instead of gas, you have things overfilling that way. So smaller kibble. You can do small, frequent diets. So I usually tell people if you've got a really big dog, at least feed twice a day. If you can feed more than that, that's better. There are some people, you know, if you have the time, that's great, but you can do it every 2 to 3 hours. It's just a little bit safer. Pretty much the idea is you're not giving them so much food that they can ingest it so quickly that it expands and causes that. That is a kind of a newer debate out in the field. Before, the idea was elevated feeding. They would not ingest as much air while they're eating, and it was safer. There are some studies now that are saying it's the opposite. You're kind of damned if you do, damned if you don't in that situation. I usually just tell people kind of keep an eye on what the research is saying. Right now it's about 50-50, so it's kind of tricky. I will tell you it's been the recommendation to elevate feeding for a very, very long time. So I wouldn't say there's been an increase in GDVs, but yeah. People will try and give them a medication to try and get that gas to go down or to pass. You cannot do that, especially if it is flipped already. Nothing is going to get to the stomach. It's just going to go down and come right back up. In some really bad cases, they can aspirate when that happens. If it's flipped, they cannot vomit. So a lot of people say, well, how are they going to aspirate if they cannot vomit? So what happens is if the stomach flips, it can't hit there and it comes right back up. If they try to vomit, that's considered regurgitation if we're going into like sciencey stuff. But if you're trying to make them vomit, it is flipped and it's pinched off, so they cannot vomit. So things can go down and come right back up, but nothing that's already in there can come up. Now, one of the things that scares the bejesus out of me, people will call the office and say, hey, I think my dog has their stomach flipped. What can I do at home? And I tell them, there's nothing, come right down. Oh, well, I used to work on a farm, and when a cow would do it, we would put a needle in their side and the gas would come out. Don't do that. If you have a needle at home, congratulations, still don't do that. The biggest risk is in surgery, when they unflip the stomach, and that usually happens once they've decompressed it, all of the toxins that have built up because of blood flow being trapped get released. That is by far the most dangerous time in surgery. So people will say, oh, I've already gone in, they've already flipped it, my dog is fine. Once that flip happens, I would say probably 50% of the times, they end up either coding or getting a really bad arrhythmia that we have to correct. Obviously, this is probably the most important, is another way to prevent it. There is a surgery called a gastropexy. There's like 10 different ways to do it. I'm not going to bore you guys with it because I hope you're not doing surgery in your garage. But it is not the perfect kind of way to prevent it, but it is our best option. What they do is usually it's during a spay or a neuter. They'll open the abdomen, they'll go in and they'll actually tack the stomach to the side. The idea is if it does bloat, it can't flip. So a bloat by itself without the flipping is much safer because you're not getting all those toxins built up. So ideally, that's what would get done. Like I said, it's not perfect. The other thing that kind of stinks with that is it needs to be done, or it should be done, when the animal is fully grown. The main reason is if you were to tack it to the side and the animal continues to grow, that stomach can actually get pulled, and then you're pretty much causing a volvulus, and you don't want that to happen. So there are other, risks with it as far as like intestines getting wrapped into where you attached it, but they're pretty uncommon, I'll be completely honest with you. Thing that we'll have a lot of people say is it's not just food, it's also water. So if you've got a dog that's in the dog park running around and they've got one of those communal water bowls, we'll talk about the rest of those later. If they're drinking a bunch of water and then they're running around, same thing, it's still a risk, it's not just food. Yeah, so that's a hard question because it really depends on the breed and it depends on the dog. So someone could have a dog that's super active and after 30 minutes their GI tract has emptied. You have some dogs that are still super active but their GI tract won't empty for an hour or 2 hours. That's to an hour. Someone else had questions? Yeah, what's up?
Is there any specific breed that they have more tendency of being bloat?
Yeah, so German Shepherds, Great Danes, St. Bernards, pretty much all of your giant breeds or your deep-chested breeds is the way they teach us. So if you see those dogs with like, the chest that goes like this and then the itty-bitty skinny waist, those are a little bit of a more high risk just because of the way that their anatomy is. It's easier for it to flip. We do see it in labs, but it's not your deep-chested breed as much. But yeah, vomit because they feel their stomach is distended, but nothing can come out. So retching is probably the most common. And then as time goes on, they get very lethargic, can barely move, very painful on belly. One thing that I always kind of hate is people say, well, my dog's abdomen's not actually bloated, so it's not bloat. Especially with your giant chest dogs, you're not going to see any bloating, or you might see a little bit, but it's not like you're going to see a pot-bellied appearance or something like that. Yeah. Foam, yeah. So, and that's another thing is because they can't vomit anything, the body is trying to get things out. So it will try and kind of get some mucus or whatever's out, and they will sometimes foam at the mouth. They can also get like an extremely high fever, which can also cause them to foam up a little bit. But one thing that sucks is you don't always get the best things, and there's no way to know if it's flipped or anything until you've done an x-ray, which is why it's not something you can really treat at home. You need to go to a vet or an ER.